out of the two vaccines, your first Pfizer vaccine made you feel a bit more poorly. So I thought, oh, if now I've got to have Pfizer, am I going to feel poorly?
Can I ask Nilesh, do you want to take that? Because you guys have a bit more experience with giving the booster Pfizer after the AZ. We've had less experience at LPT in terms of most of our staff initially got Pfizer to start with.
So I have to say, Sarah, it's really variable. So when they did a trial in this, they call this heterologous vaccination, where you have a different vaccine to your first one. And there was some evidence in a trial of a couple of thousand patients that it potentially increased the side effects with a different one. But actually, in real life, and this is a little bit anecdotal from what I've seen with my patients in the vaccination clinic, that doesn't always seem to be the case. And I've actually had some people who had Pfizer first and second dose have, some side effects that were not very pleasant with their third dose, and other people who've had AZ first and second and not know. So it's just impossible to predict it. And I think, they are different vaccines. They've got different sort of bits in them, so you could react in quite a different way. And I just wouldn't, all I would say is, I don't know quite which bit of LPT you work for, but I just wouldn't delay in having it. That's all I would say, really. I know because you can get into the, oh, do I time it so that it's at a weekend, or that it's when I'm not doing something? And I think you've just got to crack on and have it, and that's all I can say, really. I mean, with Pfizer, it's the same sorts of side effects that most people get with AZ. So it's the headache, sometimes a bit of muscle ache, sometimes a bit of a temperature, and for most people, it's something you can treat with paracetamol and a little bit of rest if you need to. So I wouldn't be too concerned about it from that perspective. But it's very variable. So I don't think there's any massive increase in side effects with a different dose, but the research did show a slight increase compared to having the same dose for the third one. And that's slightly logical, isn't it? Because if you've already had your body used to it on 2 occasions, then third occasion it's going to be less likely to react. But I don't think it's a reason to put it off there. And I think what you also have to remind yourself is the efficacy, the effectiveness of Pfizer is excellent. We would get a really good antibody response with it. And so obviously this is boosting on top of our second 2 doses. So hopefully it's going to get us through that, next 6 months and winter period, and hopefully beyond that potentially.
Yeah, thanks, Nilesh. All I would add to Nilesh's statements are that the COV Boost study, which was the study that looked at adding the third dose in patients who had a gap of at least 3 months after their double dose, and I was part of that. They have come up with some results that have been shared with us, those who are part of it, and I've seen it. And it would suggest that actually the reaction is less than you would when you get it with the first or the second dose that they would have had. So absolutely, there's going to be some reaction because, as Nilesh has pointed out, it's an autologous vaccination process. It's a different vaccine, but and there is a little boost in the immune system as a consequence, and the antibody response is going to be higher. But it's certainly nowhere near what we saw in the stages of when you were naive and got the boost and you got the doses at that time. So yeah, please don't put it off for that reason.
Are you I know that people, this is my second question now.
Yeah.
I know that there's an opportunity to get your flu jab at the same time. So am I best just to do it all in one go?
You want to? I would absolutely say that. I think why not? If you're going to have, I mean, again, the flu jab overall, most people don't get significant side effects other than a sore arm, and again, some very mild symptoms. So there's a lot of myth out there about flu vaccines. I'm not sure how many you've had over the years, but overall, it's a low rate of side effects, and you could argue if you're going to have them, you might as well have them at the same time. There's a lot of evidence of the effectiveness of having them together, so that's one of the great things that we wanted to do. And there's also that wider bit, as a health professional, we want to reduce the number of contacts our patients are going to have with the vaccination service, because it's making it harder for the NHS every time you have to bring somebody back again for another vaccine. So there's that bit, which is I think not for you, but it's for our system overall. But I would have no issues about having the two together, really wouldn't.
And actually, last weekend I gave both simultaneously to patients of mine at the PCN that I've worked for, and we haven't seen any extra issues come out in the last few days in terms of that they've got increased side effects, that they're not tolerating it. So we haven't seen that. So and most to be fair, most elderly people just want to come in and get it in one go, right? They just don't want to keep having to come back. So, you can choose to have it either way if you want it, but our advice is just come in once and get both and get it done, right?
Absolutely. Okay, that's really helpful. That was my my questions really.
Thank you, Sarah. You don't have to stay on now for the rest of the hour.
Yeah, don't feel you have to say, Sarah, but there are a couple of follow-up questions actually based on what Sarah's just said that I think might be quite useful for people that because we're recording the session as well now. But for those that may have had the AZ vaccine to begin with because they sort of thought that they had some allergies, etc. What advice would you give them to now be like switching to doing a Pfizer booster if they specifically had the AZ for allergies first time round?
So like, if I can start with that, Nilesh, and if you can add in anything that I may have missed. Well, our initial thinking to this was guided by the fact that we didn't have very much knowledge about the vaccine when it came out, and so a lot of the advice that we gave in the early part of the year in terms of taking the AZ vaccine over Pfizer if you had multiple allergies haven't borne out to be true from the data that we have now across the world. And if you look at the amount of Pfizer vaccine that's been rolled out across the world, and we're looking at nearly 3 billion doses of Pfizer that have been rolled out across the world, we are not seeing any signal coming out to suggest that patients with multiple allergies are going to be affected by having that particular mRNA vaccine. What we do know is that if you are specifically allergic to PEG, which is polyethylene glycol, which is the substituent lipid compound in which the vaccine is transported, the mRNA messenger is transported within the vials, that is probably the only real issue around allergies that we are now saying for sure that you shouldn't. So our advice is that all those issues around multiple allergies don't really stand anymore. If you tolerated the AZ and you're fine with it, you should be fine taking the Pfizer booster. At LPT, we've taken a stand in terms of if you feel that the Pfizer booster is not something that you can tolerate, because we would need something medically from either a consultant or the GP stating very clearly why that case has to be made before we would offer the AZ third vaccine as a booster. Anything else, Nilesh, you wanted to?
No, I think you're absolutely right. I suppose the only other thing for us locally is we have updated our allergy guidance pathway on this, because we were referring lots and lots of patients into the allergy service to get checked out to see whether they're suitable or not. And as Sudip has absolutely said, we realise it's actually a lot safer than we probably realised. And actually, it's a very, very minority of patients small minority of patients that may be affected by this. And even in the Green Book, which is our immunisation Bible, in there now, there is a clearer algorithm of who needs to not have it or be referred or whatever. So, and it's far fewer patients. The other thing, just to act as a little bit of reassurance, is MHRA haven't taken away the requirement for the 15-minute observation, so we're still having to do that. And again, the vast majority of patients are absolutely fine in that time. So if you're going to have a reaction, it's usually going to be in that time anyway, so you are being observed. But it is a small minority of patients. When it first came out, there was a whole list of allergies that could have precluded you. That has changed now, and it's been reduced down. So again, unless you have been told that you need to avoid it by a healthcare professional, you can probably have that conversation at the site with the person giving it just to double check it. And we're still asking all the same questions to check for the contraindications, so the reasons why you can't have it. Even though you've had vaccines before, we're checking again every opportunity to make sure it's still safe for everybody.
That's really helpful, thank you. And then just the other question that Sarah asked was around sort of flu and the vaccine together. So it was around, last year they were saying to sort of, the advice was to wait 7 days before having the either vaccine sort of between the two vaccines. So why has that now changed, and why is it now safe to have both of them together?
Nilesh, do you want to?
Okay, so there's been some research into that. So even back then, they weren't particularly concerned about having them together, but because it was a new vaccine, we weren't sure about side effects. It was a precautionary principle to say let's space it out a little bit, and it was also so that we could very clearly see which vaccine was giving side effects. So with a new vaccine, we wanted to know what sort of side effects were you getting, what were the problems, what were the complications. If we gave two together back then, we wouldn't have been able to study the Pfizer and the AZ vaccines so well. Now, as Philip said, we've done billions of doses across the world. We've got a lot more safety information, a lot more research into the vaccine, and a specific trial has actually taken place to give both vaccines together and say it's absolutely safe to do that. And actually we do that already. So a lot of our patients who come for a flu jab, if they're over 65 or they're in a high risk group, get a pneumonia vaccine at the same time. There's only one vaccine at the moment that we have to space out by 7 days, and that's the shingles vaccine. And that's only for people aged between 70 and 80 years of age. So that's a small group of the population. All other vaccines, as far as we're aware, can be taken together, and we encourage again people to have them together where possible. You're helping the NHS there, and the evidence says that's absolutely safe to do so. And just in terms of people worrying about your immune system managing more than one vaccine together, we have to remember what we do to our little children. So our little children get 6 to 10 vaccines in one go when they're going through their childhood immunisation campaign. They get their diphtheria, their polio, their tetanus, their meningitis, their pneumonia, their rotavirus, all on the same day, and their immune systems cope absolutely fine with that. So there's no evidence that it's too much for your immune system or anything like that.
Thank you, Nilesh. I absolutely agree. And I think on the flip side of this is that if you decide just to take one or the other, the morbidity associated with developing both flu and COVID-19 together is now, that research has clearly come out. And there is now a twofold increase in hospitalization and potentially even ITU entry with patients who develop both the diseases at the same time. So if you're going to get protected, go and get protected in one go with both vaccines, and you really negate that that consideration completely, really.
That's really helpful, thank you. So anybody, is there anything else that you wanted to sort of share in terms of key messages or things that you think might be useful for people to know about the booster vaccine?
I think from my perspective and from the system perspective, we need those over 50 to come and get both their flu and their booster vaccine as quickly as we can. The flu season is starting slightly earlier this year than we would have thought it would have started. There's peaks now happening in areas of Europe, which we never expected to have in terms of RSV that we are seeing now. We think that will translate very clearly into the UK shores within weeks. So COVID is still at a very high rate in the community. I accept that most of it is in young children and young adults at this point, but as we move indoors and winter starts to bite, there is no reason why we won't think that will translate into the slightly more adult age group. So the more protected you are, the earlier protected you are, that group really, especially frontline NHS workers, they need the protection more than anybody else quickly. So that's my plea, really. If we can get people get on and get this booster and the flu vaccine at the same time, we will not only help the NHS, you will help yourself.
Yeah, I'd echo that. And I think also, while we've done absolutely amazingly in LLR in terms of vaccinating our populations, we still do have a significant minority of patients who haven't been vaccinated, and as healthcare professionals we're having contact with some of those patients. So as well as topping up our antibody levels and making sure that booster is still working, and we've got that individual protection for ourselves and for our families, I think a lot of us have a moral and ethical duty to make sure that we're protecting our patients as well there. So there's the wider public health message, as Sudip said there.
That's great, thank you both. That was really, really useful.
Cami, is it just worth commenting on just very briefly on Moderna? So
yes, please.
We've talked about Pfizer quite a lot, but there's been nationally a large purchasing of Moderna. So we are starting to see Moderna come out now. We haven't had a lot of Moderna in LLR actually, but we're going to be seeing Moderna coming out to more and more sites, including some of the local PCN sites as well now. And that's a very similar vaccine in terms of its makeup to the Pfizer vaccine. It's an mRNA vaccine. It's a very similar sort of side effect profile and very similar efficacy, so effectiveness as well. So a lot of those principles that we've said today are the same for that. And absolutely recommend people, if they get invited to a vaccination centre and it's Moderna that's being offered, to take that up. No other reservations or concerns about that, just as we've described today with Pfizer. We will start to see a lot more Moderna in our system. It's gradually going to be coming in, so not to be shocked or surprised if your vaccination centre offers you Moderna.
No, that's really helpful, because I don't think we know as much about Moderna. It's not really been, widely sort of publicised as much in terms of, the sort of efficacy of it, the evidence around it. So is there anything more that, you could share about the Moderna vaccine and what it's been through and how it's being used?
So can I just come in on that? I think Nilesh raises a very valid point. We've been undersupplied in some ways with Moderna for some time, because we didn't pre-order what we could have ordered, but then we pre-ordered Pfizer in buckets, right, compared to a lot of other countries. So they are exactly similar vaccines made in a similar co-production manner. The only difference is the cold chain issue around the supply of the vaccine and being able to get to us. They are both mRNA vaccines. They have the efficacy data for Moderna is as good as Pfizer, right, in terms of efficacy and safety. In fact, when you look at the data that's coming out for booster doses, you only need half the dose of Moderna to get almost the same efficacy rates as you do with a single booster dose of Pfizer. And hence there is the recommendation that actually you could get away with half dose Moderna as the booster dose. So, there's some positivity in that. There have been some reports of Moderna not being used by now Northern European countries for very young people because of some association with myocardial and heart problems. But that signal is, again, quite faint. And we haven't, certainly MHRA have looked at this very carefully and have not put out a signal for us to be concerned about at that level. So the message is, yeah, it's going to come, because now we've increased the order, and it's going to come across all sites, I gather, now across the country. And so although we at LPT have been using it since July, because we've had a stock of it supplied through the system to us, PCNs haven't, right? So it's going to be a slightly bigger issue for them as they start to dispense this particular vaccine out.
That's really helpful. Thank you, Sudip. Has anyone got any other final questions before we finish? Richard?
Is it likely we'll be gearing up for another set of boosters in 6 months' time?
I'm not sure that we've got the sort of research or the knowledge for that at the moment. So I think it's something that will be looked at. I'm sure there are research trials going on to look into that. I don't know if Sudip has any further knowledge on that, but we will obviously have to see how long the immune system response, antibody response, and what's also called the T cell response lasts after this third dose, this booster, to see whether that's required or not, and what the state of the pandemic is globally. Sudip, I'm not sure if you've got any information on that.
So thank you, Nilesh. All I can say is that the COV Boost trial, which is designed to answer this question about long-term immunity in some ways after the third dose, will report in August of 2022. And I don't think any decision about a fourth boost will be made until that time. I think it does really depend on what we see over the next 6 months, whether truly we move into the endemic phase of this pandemic. We seem to think that we are moving into an endemic phase, albeit at a reasonably high rate. But everything is pointing towards this virus now becoming more and more flu-like in its actions, especially if you've had the vaccination. That doesn't mean that the unvaccinated people are going to be protected, because this is a novel virus for the unvaccinated in that sense. So therefore, your immune system is what does the damage to you, not the virus per se, no matter what it changes. But to the vaccinated, it's certainly becoming more flu-like. We haven't required boosting doses for vaccinations for flu on a 6-monthly basis ever, right? That is usually something we reserve for 2-3 yearly cycles of what we see, and we don't expect to not see this with this virus. There's nothing in this virus that's exceptionally special that we haven't seen in other sort of flu-like coronaviruses that we've had in the past. The only difference with this virus is that it's not burnt itself out, right? All the other coronaviruses in the last 20 years have burnt itself out within a year. This one just seems to be hanging on. It's learnt, it's evolved, like all other biological entities, and therefore we've moved into this phase. But I personally don't see a 4th booster coming in unless the COV boost study tells us that in a period of up to a year post the boost, and most of us would have had a year, in those who are in the study would have had a full year of the 3rd boost, and that will be by June of next year.
Okay, thank you.
Thank you. Good question, Richard. Yeah, great. Thank you very much. Okay, anything else from anyone? Okay, I'm gonna.
Can we ask each other questions?